Okay, welcome everyone to this session as we take a look at the advanced searching for CINAHL on the new EBSCOhost user interface. Of course, it is now the interface, having replaced the legacy classic EBSCOhost almost a month ago now. So I'm Richard Crooks. I'm a senior customer training specialist, of course, with EBSCO, having been with EBSCO now for about 14 years and previously worked as a medical librarian in my NHS days, as it were. So glad you could join the session this morning. So in terms of what we're going to cover, we'll look at the navigation update. So there were some changes in early July prior to your migration to this new platform. So just to highlight those. Also, again, we'll look at the title subject searching. So the principles of searching on this interface now. Also using the search history. So there's been enhancements over the last few months for that. So I'll highlight those. And also the matter of precision searching, which is essentially the same as it was with the legacy interface. And also the matter of exporting results. I know we've had some questions about direct exporting. So again, I can point out the way you go for that, etc. And also saving, sharing, and downloading. So there have been some changes, especially in relation to what you can do with the search history. So in terms of the actual objectives, I hope that within the hour, you'll be able to identify and utilize navigation features. Some of you, of course, perhaps all of you, have already been on the platform to explore it. But again, we'll highlight these elements. Also, be able to form title and subject searches for CINAHL and EBSCOhost. Again, so this is quite basic, but again, just to reiterate, and also for any who may be joining this session or watching the recording at a later date who are not so familiar with CINAHL and EBSCOhost. You also be able to combine the keyword, that is the free text, and CINAHL headings, the subject searches, using the search history, go through the steps there, and also apply the proximity operators to improve search results. And of course, as I mentioned, export results in RIS and other formats for bibliographic software. Okay, so, and we'll look at also the saving, sharing, download results and searches for this session. So there's quite a lot to cover. So I'll go through these elements first, and then we'll go into the live demonstration. So we do have a research question that we're going to seek to answer or find references or evidence for. So we'll do that in the live demonstration. So this is the new interface. I'm using the NHS account, the central account through Open Athens. And on this page, you can now see that the left-hand navigation that was there up until early July has been switched to the top toolbar. So that will not change now. That will remain up there, as it were. So that's based on feedback, also for future enhancements to the platform as needed as well. So just for ease of navigation, primarily based on feedback. So again, you've got the top navigation toolbar, the navigation items that are regrouped into those areas, as we'll see live, and the dashboard area where you have your project save folder, recent activity and so on, alerts, is now moved and been grouped together with the EBSCO personal user account. So EBSCO, of course, is the personal user account, which, when authenticated, allows you to access additional materials, full text content, and particularly, of course, allows you to create alerts, save searches, and so on beyond the session. So for yourselves, within NHS England, you have EBSCO single sign-on, which means that once you authenticate into CINAHL via Open Athens, you'll be automatically signed into your folder. So you won't need to sign in again during the course of that session, which means that items will be saved beyond the session when you save them. So again, we'll go through that live as well. A recap then, in terms of title object searching, we have the XB field code, as you can see highlighted there. So you enter your search terms, your search string, choose XB from the drop-down menu, and you'll search within both fields simultaneously, and it is title or abstract. Okay, so we did have title and abstract originally when this feature was launched last year, but with such an outcry and with feedback, it was changed to or abstract, which reflects what it does essentially. And for more information, please consult the help sheet highlighted in the PowerPoint there. And you can, of course, use a command line query. So if you prefer, you can use the field code XB to prefix the search terms and run the same search. So whether you're happy just to enter your search strings line by line in the search boxes and then prefix those with the field code, you can do that, or choose from the drop-down menu with the choices that are available. I also want to mention, and if you cross-search this with Medline, that XB field code will not be applicable. You would need to use the title or abstract field codes to search simultaneously across both databases. So it only works for individual databases, but XB is also available for Medline on EBSCOhost as well. So subject headings, obviously many of you are familiar with the suggested terms that was there for the legacy interface. Obviously a slight change here because it's being moved to the bottom as opposed to the top search box. So you can see it's highlighted here. So you enter your keyword search terms, that you want to map to the index term. So once you select suggested terms, the button that says search will be switched to suggest terms. So it's more explicit what it's doing. And once you click that, it will direct you to the appropriate index term, the CINAHL heading as shown here. So you can see here for GORD or GERD, etc. It's mapping us to gastroesophageal reflux. Okay, so again, that's the way that it works. That means you can then select the actual heading and then you can add that to the search to retrieve records indexed with the appropriate CINAHL heading. Okay, so that's using suggested terms. Key difference is that the tick box is now below the third row, the third search box, as opposed to the top where it was in the legacy interface. Also to mention, in terms of processing results as well, we do now offer the multi-select. Up to 500 records can be selected to download, to share, to add to projects, to cite and export. So you can directly export up to 500 records now from the result list, not the 50 as it always has been for a long time. So you can still view 50 records per page in the display as a maximum, but you can now select up to 500 records. So of course, if you have 1500 records, then you would download or share in batches of 500. We still offer the option to export as well. So again, you can still export up to 25,000 search results. So it handles a lot, larger result sets as it were. So again, that works in the same way as before. And again, the advantage of having EBSCO single sign-on means that when you select these options, they're already there essentially. So select 500, we do require users to sign into a personal user account, a EBSCO account for yourselves using single sign-on. That issue shouldn't be an issue at all. Okay, so select 500 should always be there showing up once you're signed into CINAHL, etc. And the export feature will also be there as well, and you will not need to sign in again to export a link, to retrieve that, to send a link to your inbox, as it were. So again, we'll look at those live as you go through this. Also, heads up about the search history as well. You can see here that the search history does display the database or databases that you're searching with the what we call the pancake icon in the center column on the right there. And in addition to that, when you include filters in your search, so language, date, etc., these are also detailed in the search history on screen. And the bulk actions toolbar has been enhanced. So you can not only download, save, add to a project, you can now also delete your search history or delete lines of the search simultaneously as needed. So a few enhancements there. And also importantly, the save search set feature. And so you may have seen this in some of the recent sessions I've been doing on supporting certificate reviews, but basically it now means you can save the entire search set as shown here on this screen. Okay, so you can select the search set. That will give you a dialog box to name that search set. You can add a description, so it could be the research question, it could be the PICO strategy you use, whatever it might be. It's free text. That will then be available, accessible in the save folder. So that's accessible from the EBSCO area. And these saved search sets, by the way, can be listed alphabetically, A to Z or Z to A, and they can also be sorted by most recent or oldest as well. So again, once you've built up a large history of search sets, you can sort them easily, as it were, and you can also go in and edit the name if you change your naming conventions, etc., or you do that hastily and you want to correct that, you can do that. And likewise with the description, you can also add that once you save the search set. And of course, that's with a view that you'd also run it. So once you click on the search set that you want to run, it will then display the search history, and then you click rerun search set and that will run in the search history. Okay, that will display accordingly. So again, one thing I'll mention to you as well, that whichever database that you save search set in, it will run on that database. Okay, so if you save it as a search set in CINAHL, it will not, and you have Medline open, it will still display results from CINAHL. Okay, so again, bear that in mind. We have a question that we want to answer here, so we can construct a search query, so we can show you how to do that on the interface as it stands and how we can process those results. So in terms of what we've got here, does dietary carbohydrate intake influence healthy weight maintenance in patients who have a family history of obesity? So we've got the research question, we've got the key elements highlighted there: dietary carbohydrate, healthy weight maintenance, family history of obesity. So some terms there that we can play with, that we can identify search terms for, synonyms for, and subsequently the CINAHL headings for to run that search. So that, of course, lends itself to a PICO type question, a PICO type framework. I've got PICO there, of course. So we have the family history of obesity, which means that we'll need to look up obesity, obese, overweight, weight gain, synonyms, and so on. We've got the uppercase obesity there, which will be the CINAHL heading. Would also be a mesh term where appropriate if you use the Medline. Carbs intake, so we look at carbs, dietary carbohydrates, or carbohydrates. Again, in uppercase, carbohydrates as the main term in CINAHL or Medline. And then we've got, or no comparison in this instance, we have got an outcome, which is really healthy weight maintenance. So we've got weight loss, weight management, weight reduction, and so on. And that can be rendered, articles about health and weight could also be assigned weight gain, weight control headings as well. So again, I've broken it down into the free text keyword search terms. We can search these within the title search field, and also the uppercase terms being the CINAHL headings. Again, we may not know what they are from the outset. Some of us may know from experiences of running CINAHL searches. We know those terms are there. Other times we'll find them through various means, including the use of suggested terms. So this is what we're going to be working on in the live demonstration. So we'll now go there. I am not going to necessarily focus or give more information about the syntax we're using as such. I may refer to it during the course of the session, but just for sake of time to make sure that we cover what we need to cover, I'm going to go through the sample search now and point out some of the key features that I introduced in the PowerPoint. So I'm going to switch over now to my desktop and you should see CINAHL. Again, I've gone through Open Athens using an NHS account, as it were. So I'm not going through internally this time. And so what you see here is what you should see. This, of course, is national. You may have some slight changes to this. I very much doubt it. But one thing you might have changed or might not yet have changed is with essential links here, you'll see a list of databases. So we've got CINAHL and EBSCOhost here, of course, Medline, and other platforms as well. So again, this may slightly differ your end, but obviously if you want your users to get to CINAHL, if they're not in CINAHL, of course, then you could place the link up here, as it were. So again, some of these have been centrally determined, as it were, and customizable within EBSCO Experience Manager. So at the moment, I've not been requested to do sessions on that because generally speaking, a lot of what's shown now is being agreed at national level and rolled out to yourselves throughout England. So again, obviously some of the content will differ. You have different subscriptions, higher end versions of databases you may have upgraded, for example, from CINAHL to CINAHL Ultimate, but the look and feel largely will be the same for yourselves. So we've got the navigation, as I said, you've got the new search options. So wherever you are in the interface, you want to go back to this page, the landing page, then obviously new search is a logical place to go to. So browse by, that gives you the link to publications. So again, if you want to browse the publications or search for publications within CINAHL specifically, then you can use the search box, the alpha menu, or browse the listing below. Okay, so that's the publications link there, and CINAHL, and that also corresponds with the tab that you see below. So once you click on that, it takes you to this tab. Likewise with CINAHL headings, if you go to CINAHL headings under browse by, it directs you to the CINAHL index and you can search for terms within the heading. So we'll do that separately. And then also the research tools, publications A to Z, that will just take you to publication finder. Okay, so from EBSCO, so you can search for full text publications within this service, as it were. We won't cover that today, but just to remind you that there's a link to it from there. And I mentioned the essential links are here as well. And the help menu here, if I click on that now, that takes you to EBSCO Connect. It takes you to the quick start guide. So this is pretty comprehensive in terms of the new platform. If you're looking at any elements that you want more information on, so for example, if you're looking at, let's see, browsing CINAHL mesh headings, you can see this link here. And that will take you to this page, which also gives you a link to the tutorial. So again, it outlines the new interface and how you select not only subject headings, but also subheadings as well. So again, useful resource there, the quick start guide. So again, that's embedded here under the help menu there. We do have also the translation icon, by the way. So if any of your users, colleagues prefer to use the interface in their own native language, you can see the languages that are supported currently. Okay, so I just French here, just briefly, you'll see how that would look like. And it switches the labels, the terms. Obviously, some of these I may not be translatable because they're customized, as it were, but most will be. Okay, so again, that's just the detail there for those who may want to review the interface in their own language, as it were. So it could be useful for new staff and so on. And then under my name, you'll see here, this is the EBSCO area. So switch from EBSCO when I'm not signed in to Richard, but you will be signed in once you authenticate with Open Athens. And you can see we've got access to projects here, save folder, receptivity alerts. Again, these features you may also be already familiar with because they were initially displayed on the left-hand column when this platform was released last year, but obviously you've only migrated recently. So this was changed prior to that migration. So again, just to point out those elements are there, and we'll come back to that. So let us go on with the search itself. So we're going to start searching for this particular area. So let me now just begin the process for this search. So let me just begin to enter some of these key terms that we were referring to from this search. So bear with me here. Oh, not here, sorry. Okay, so let me now just do this. Okay, so we had obesity as the first thing. So we'll look at the keyword search initially. So I'll put in obesity. So it could be obese, of course, or obesity. So just simply obesity. But we could also add, overweight. That could be one word, or it could be two words. I'll put that as an exact phrase as well. So overweight in 2 words, or it could be weight gain, or gain weight, for example. So you could put gain weight or weight gain. So I'm going to put this in parentheses. I can put in gain weight or weight gain, and I'll put the near operator. So I'll put in a near 1 or less and gain. Okay, so that could be weight gain or gain weight. Okay, so that's near 1 word or less. And anything else, maybe not at this stage. So what I'll do here is just put in the XB search here. So let me do that. So I'm satisfied with that. Now, if we do make mistakes or if we spot errors, we can easily change them in the search history. So I'll run this search and just point out as the search history appears on screen. So this will be set 1, and you can see here it's loading now. So set 1, okay, and you can see the search string with the truncation with the use of the near operator. And then I've got the search options are embedded. So for yourselves in NHS England, the proximity search has been changed from near 5 words or less to W0, with basically words next to each other in the order you enter them. So that's being reconfigured behind the scenes in EBSCO admin to reflect phrase searching. Okay, so that is typically where it's going to impact an unqualified keyword search. The results are hyperlinked, by the way, so you'll notice in each result set, these are hyperlinked, which means you can jump to that result set. Obviously, we're looking at those below right now. But once you have multiple sets here displayed, you can click on any one of these results set and view those results specifically within the result list without incurring another duplicated search set, as it were. So we'll see that as we go on. The pancake icon, or I call it a cylinder as well, shows us we're searching CINAHL, we're in the right database. The save ribbon is where you can save this search string to a save folder if you need to. And then there's the kebab menu, the tools menu, where you can edit the search. So if you wanted to change the syntax, if you want to add a term, remove a term, you could do that. Add to project is simply adding it to a custom folder, and then delete, obviously, to remove it if you need to. So again, just some areas of the tools there. So obviously, once you've searched for the keyword search, or we use the title or abstract search, we could then be looking at the equivalent subject search. So to do that, if I put in obesity, I will browse the thesaurus for this term. So click suggested terms. There's a little I button there. So just explain to the user what this is actually doing. What does this mean? And then the search button has now been switched to suggest terms, which I pointed out in the slide deck. So if I click suggest terms, it will now direct me to the appropriate index term, which, as unsurprisingly, is obesity. Okay. Now, if I select obesity, by the way, go into it, it will give us the scope note. So it is an abnormal accumulation of body fat, etc. It's used for overweight. So obviously, if I browse for overweight, it would direct me to this term as well. So this is the official index term provided by the National Life Medicine for CINAHL. We can select it here. There are related headings that we can select if we need to. but we won't use any of these today. And then we see the subject tree below. So this comes out under, of course, body weight, growth, etc. Now, you may notice this compared to other sessions that I've run. The auto explode is now being disabled. So that was that request for yourselves. So again, if you want to explode obesity to include obesity paradox, obesity maternal, and so on, then you would now need to select explode from the explode column to include those narrow terms. Okay, so there's a change there in terms of a default setting. So it's agreed nationally that auto explode will be switched off. You need to select that yourself directly. If we open up the subheadings here, just to clarify this, and there may be a change to this soon, we have all these subheadings, a list of subheadings, and you'll see it says select all subheadings. So there's been a bit of a misconception here because these subheadings are not all applied to every index occurrence for obesity in the database. So for example, obesity is the main index term for about, as you see the scope note there, so in relation to overweight and so on. You can qualify that search by focusing on different elements. So for example, etiology, prognosis, and things like this. Diet therapy as well. So you may want to focus on diet therapy in particular in relation to obesity. And you see the scope note for that. Now, obviously, when you apply any of these subheadings, it does qualify, it does focus the search. So for diet therapy, obviously, you'd retrieve articles indexed with obesity where diet therapy is the focus. If you select all subheadings, it will apply each one of these to this in the same way, but not all items indexed in CINAHL about obesity have been assigned subheadings. So again, select all subheadings kind of misleading. This may change. It was originally indicated that it would focus or restrict your search. It's been changed for some reason. So that will probably be edited at some point. So just to clarify then, you will not necessarily get the same results if you select all subheadings as if you would leave that off and just select obesity and have it explode on. Okay, or even without explode, you still may end up with more items indexed with obesity than if you select all subheadings. Okay, so I hope that makes some sense. So the bottom line is, if you want to find the majority of references or most references that are in, or all references indexed with obesity, then you want obesity, and if you want to include those narrow terms, select explode. Okay, so we've had some questions about that. So what I do now is just, go to the top of the screen and add that to my search box. You can see the single term is there. It's been exploded, indicated by the plus sign, and I can click search, and I will now retrieve records indexed with that main term and the associated narrow terms because I've also exploded it. So I'm going to select both sets here. So again, select both. Use the OR operator combined with OR here. That will then place the two sets in the above search box, and I click search to run that. So I end up with a third set, set 3 or S3 in the search history. And you'll notice that it's displayed in reverse chronological order as well. But you can resort using the ID option to see the sequence. Okay. So that's obesity. Now, obviously, we're looking at carbs, carbohydrates. So what we can do here, again, we can explore this further. We can put in carbs here or carbohydrates. Okay. To be quite general initially, we could put dietary carbohydrates, of course, as well, if we want to be more specific, but we should cover that with carbohydrates. But just for the sake of clarity here, I'll put dietary carbohydrates, and then I go to put more carbohydrates. Carbohydrates. Okay, just for now. And then select XB, and then run the search, the keyword search for the intervention, or carbs intake, basically. And you might argue that's exposure rather than intervention. To be honest, it could be a PAO search more likely than PICO. So maybe review this. So that's carbohydrates, as it were, as a keyword search. Now, of course, we want to find the equivalent search. So we could put carbohydrates. Again, I might keep it quite general and browse the thesaurus using the suggested terms. Click suggest terms, and then you'll see we've got carbohydrates here. We have got dietary carbohydrates as well. So we can look at either. So obviously carbohydrates is here. We click on that one, and you see the definition there, what it's used for. Okay, and you can see it's here. Okay, and dietary carbohydrates is also here as well. So again, we explode this term. That should also include those. So we can go for the lead term, as it were, the main term, and select add to search, and then run that. So I'll keep it kind of broad at first to ensure that I find what's out there, as it were. So I'm just going to double check questions. So again, if you've got any questions or considerations about doing it this way, then please feel free to share it in the Teams chat. We can follow up as needed. So I combine the two together, as you'd expect. Again, the process is the same. Combine with OR, it places the top two search sets in the two search sets in the top search box, and then run the search. So once that's done, that'll be S6. Okay. And then we're looking at the matter of weight reduction, weight gain, etc. So again, or healthy weight. So for example, I can put in, again, I could do weight that is healthy or healthy weight. So I could put, for example, healthy, and let's put three words or less weight. So it could be weight that is healthy or healthy weight, for example, do it that way, or weight loss. So it could be a phrase as well, weight loss. Actually, again, we could do the same thing, or loss of weight, weight loss, or split to loss, so loss of weight or weight loss, or weight management. Again, it could be weight management, weight, and to or manage, it could be managed as well. So I truncate that as well. So again, I'm looking at different ways to use the proximity precision operators to enhance the search. So healthy weight or weight that is healthy, weight loss or loss of weight, weight gain, and then there's weight gain as well. Now I could simplify this probably. So I'm just looking at another option here that I may well change this. Let's see. Yeah, in fact, I could do it this way. I could simplify this. So if I put weight, and let's put N3 to go on basis. So weight loss or gain or healthy. I could even truncate that for health weight. I don't know if that would make sense, but or healthier weight. So if I truncate that, so that could be health, healthier, or healthy. Or reduction or reduce weight, so I could truncate that as well. So I'm exploring some of these features, or control. So again, or control weight. So I'll put control and then truncate that as well. So again, I've played around this before, but I'm now doing something different. So it could be, yeah, weight loss, healthy weight, reduction of weight, weight reduction, control weight, etc. Okay, and again, the number N3, you could say N2, you might even go for N4, but the number is literal 3 words or less. So it'd be weight, near, 3 words less of any of those terms. So it's in any order. So it could be loss of weight, weight loss, etc. So again, I'm trying something different today. And then click search here. Or the other one I might add is healthy BMI. I might leave that one for now. Let me just run this one for now. So again, and I'll show how you can edit that. If you want to add other terms, then I can show how to edit that in a moment. So what I'll do, just run that search, and then I'll do the equivalent for the sim headings. Now, of course, you don't have to use suggested terms. You can just go browse by, use sim headings, but it does tend to leave the search string up here. So I'd have to clear this and then remove this. And then, for example, if I put in, I think on weight, was it weight reduction? Or I put weight management. Okay, so browse the thesaurus. This is just another way of browsing the thesaurus. I find using suggested terms is now generally easier. You see, for weight management, we should use weight control. So I click that term. So we've got weight control there. It's used for weight maintenance, weight management, and so on, which is in line with what we're looking for. You've also got, before 1993, these others as well. So again, you want to consider other terms. So we've got those. Scroll down. Weight reduction programs is here as well. So notice they're not, you cannot explode them. There's no narrow terms. There are single terms there. Okay, so we've got those as well. Okay, but we'll just go for those two for now, sake of time. And then we can add to the search and click search. So we're going to combine that, of course, with our index search, with the title abstract search. And it may be that you may opt to go for an unqualified search, using all fields rather than the XB field code. So you may want to try that and find more results there. And then S7, S8 combined with OR, and then search here. So just wait for that to complete. And we've got S9. So we've got 3 sets essentially. Again, as I'm looking at this, thinking, well, PIO may be more preferential to PICO because we really look at an exposure to dietary carbohydrates, etc. And then obviously the outcome being the healthy maintenance to weight and so on. So again, I might review this search and change it in terms of a PIO rather than the PICO search, but the principles are there. And we have got those 3 elements. So if I just resort using the ID option above the search sets, you'll see the search strings related to obesity, S3, those related to carbohydrates, S4, S6, and then the weight, maintenance gain, etc., S9. So what I'll do here is combine with and again, that's did on the top search box. When I run search, it'll combine the 3 sets and also bring us a result set that we ought to focus on. So I'm going to go down here. So we've got 5,000 references. So a good number, but obviously we may want to filter this further. So we can apply filters to the search. So let's go for English language here. And then also publication date. So we'll look at the last 10 years in this instance. There is a custom date range, by the way, so you can put in a year on year, or open-ended as well. So month and year is also supported. So when you select year or add a year, so say you put 2021, it'll be January 1st, 2021, and the end date will be December 2026, even though we're not there yet. Okay, so we've got those 2 options, so we can apply these filters. What's going on here? Maybe just do this. Oh, I know why, because I haven't selected the date range. So if I go to past, so whenever you see the apply button grayed out, it means there's another step that you need to complete. So if I apply these 2 filters now, okay, and you see we've got these 2,485 results, and notice in the search history, the 2 filters are also recorded. Okay, so for reporting purposes, certainly when you come to download this search history, this is useful. Okay, so as I mentioned, you have got the option to explore the individual result sets when needed. You may want to look for other terms. So for example, if we were looking at the, let's see, this S8 weight control, this is the subject term search. If you would click on the result set there, and then if you click on that, that will display those results below. Okay, so we're now looking at that result set specifically, and you can see we've got the subject headings here. So you can see weight reduction programs as mentioned here. You can look for other elements that maybe you want to factor in, maybe you missed originally. Okay, so this one has 27 headings assigned to it, etc. So it gives you an opportunity to explore that. You can also explore the abstracts where available. So you'll notice also now, it was obviously agreed at a national level to have the abstracts displayed by default. So now if abstracts are not shown, it means these are pre-CINAHL records. They're not fully indexed yet. The abstract is not there for those records. Otherwise, you'll see it displayed in its entirety. If you want to hide that, you can click show less, and it'll take up less space on the screen. But again, by default now, you should be seeing the abstract displayed up front, as it were. So that would have been taken at a national level, assuming with some consultation from yourselves, based on feedback, etc., when exploring this interface. Okay, so we've got the result sets there. Again, you'll notice, although I'm looking at result set, which is set 8, S8, in the results list, it hasn't duplicated that search string. So still within the 11 sets of this search, I can still go back and explore those results. Now, obviously, you may well have much more extensive searches, possibly up to 60, 70 lines, possibly more, possibly in 3 figures. So you can, from this menu here, you can download up to 1,000. okay, lines in total. Okay, so again, there's quite a lot of capacity to download the search history, okay, from the screen. Okay, so let me see. Now, there was one other thing I wanted to do, and that was apply. Let's see now, apply. So we've been asked about this, about publication types in recent times, and how do you then select a publication type? So obviously on the filters panel currently on the left, so it's been moved to the left here, you'll see we've got source types, which relates to the, the academic journals, magazines, and so on. But obviously publication type is not indicated here. You've got publication, of course, which is publisher, and we've got others like age and gender. These can be applied. But if you want to apply publication type specifically to the search, and if you've not done that previously when you ran the initial search, then what you can do here is if you click edit, the edit search details here, okay, and then go to edit search. And then on this page, you'll see this is the final search string. We've got the filters tab. So if you go to filters tab, you can see we've got English language already selected, past 10 years already selected, and then jump down to publication type. And then we can go for example, let's go for meta-analysis. Okay, we go for practice guidelines as well. And then I'll go for systematic review. Okay, for those three so far. And then we update the search. Don't worry about this error. This is a glitch, I think. So click on that. I run the search and then click the cross or continue again. A bit convoluted, but this is kind of the way that you can do it. And now you'll see those elements are included. So we have 166 references, which are identified as meta-analyses, practice guidelines, or systematic review. Again, you see the other elements there. So if I click ID to resort this, again, you'll see that in sequence. So it's recorded this in the search history. I can click on that number now and view that result set. So I've refined the search, not only based on language, English language, published in the past 10 years, I've now identified these publication types. So these should either be in this case, you can see the first one here is a systematic review and meta-analysis. Okay. And then likewise, the second one, and so on. So again, much more high quality, top level evidence, as it were, compared to the other references, which are more than almost 2,500. So we focused our search results. So again, that's one way that you can apply the publication type filter to your search. Okay, so now we've been asked about that. So we've been doing a bit of digging, exploring. So at the moment, that's the way. And also notice on the left-hand panel, it is recording those filters. These are now active. So notice there's a little icon there, the padlock, which means that they will stick. If you run another search, these will be applied to that search. So if you want to run another search, then you need to clear all here. Okay. As I mentioned, you can also select the result set and delete from here. So when you click delete, it will check with you that you want to do that. Okay. So again, you can clear the search history in that way. Okay, so I'm going to move on here. Now, obviously, at this stage, I'm going to hide the search history for now. If you want to process records, 166. So in the past, you would go into here, select the first 50, and then you have to do another 50, etc. Now we have select 500. So I can select these, select 500 as it were, and I can download this list. So in this one click, I'm downloading all 166 items. Choice of format, PDF or Word, and click download. And then I can generate the document for that. I won't open it up just for sake of time, but I would need to save that first, and then I can open it up. So if it's a Word document, I can edit it, I can cut and paste it to another document, and so on. So that's been saved. Obviously, if you have more than 500, then you would select the next batch of 500. Also, we can select the save icon, so I can also do the same. Save. So it means I'm saving 166 records at once. I'm not going through to multiple pages. Click cancel here. And if I go to my save folder, you'll see the first tab are the records that I've saved. So there's 166. I've actually saved some previously, by the way. That's why it's 131. So essentially then, this also allows you to go through the list. You can unsave records if you need to as well. just by clicking the ribbon icon. So you can unsave this one, for example, and that'll move it from the list. You can check the links to the full text, etc. And also you can select from this list and you can share from here as well. So you can download also, and you can share. OneDrive is there, email is there also. Again, with those options, the detailed citation is the default format for sharing, so you can add or remove fields when you share those records. That's another email address you have, or with clinicians, nurses, and so on. And the site tool also allows you to do a direct export from here as well into RIS format, RefWorks, EndNote, and so on, as well as copying the citations. So that's with this list from within this page. But if we go back to the search screen, as it were, again, from the list that we saw, so again, we've got 166 records, we can then select these, and with the 500 selected, we can add to the project. So if we have a project that we're working on, it could be an assignment, it could be an evidence search, and you've created the project beforehand. So for example, this one here, I don't think I've got one actually. So what I can do here, create a new project. So it'll do that in a moment, or allow me to do that, and I can put in the weight maintenance. I'll just call it for that now. Okay, maintenance. Okay, and then I can give it a due date if I need to get it completed by a certain date, and description. I can put the research question here and then create that. Okay, and then I can then add those 500 records, 166 actually, to the project itself. Okay, so I can do that. And while I'm here, I just want to show you this as well. With the search history, I can also select the search history and add that to the same project as well. So I can group the search history with the project itself with those records. So click add now. So 11 items means 11 sets. And if I go to the top of the screen and access my projects folder within my EBSCO area, you'll see I've got this project, health and maintenance. Click on it now. It gives me those records that I've just saved, 166, just one click. I've downloaded them. I can access them. And again, you can go through the list. You can delete them all if you need to. And then there's the search itself. So the search is recorded and detailed here. Now that's quite useful for you online as a record to see what you've done, etc. But obviously there are other ways to manage your search with search sets, which I'll show you in a moment. So let me just finally go through the other features that we saw. Yeah, if there's any comments or questions, please feel free to post them in the Teams chat at this time. So I can hide the search history again, collapse that. And then if I select this option, so select these, share. Now I've not selected the 500, so what I could do here is 166. So I can go in and select. So by default, it will default to 1 to 50. So I hit select 500 here and then share. It will give me the option to choose that listing. So 166 references, again, OneDrive, email. I can add my email address. Again, the option, the range is given there. So if you have 1,000 records, you would then see 501 to 1,000, etc. And then the detailed citation is the default display for your sales at NHS England. And again, you can decide whether you want all these options or only some of them, and then you would send. Okay, so again, you can process now up to 500 records. In this case, 166 can be sent in one click. And then the site tool from here as well. So where we see the site tool, of course, it has the same functionality. Either you're going to copy the citations. So again, for Harvard referencing, you copy all 500 citations, copy into the clipboard, and obviously paste them. Otherwise, you can do the direct export of 166 references. Okay, so again, there is enhancements to the processing of results. In fact, it's a 10-fold increase. So if you have 500 records, you can still process it in the same way as 166. If you have 1,000, obviously there's going to be ranges that you need to work with as well. So again, you'll see also this little button here. Okay, and this, by the way, gives you the hit count. So again, we record the hit count, the total results at the top of the screen, And at the end of the page, you'll see unique results, which are a unique result set. So any duplicated results are removed. Now that's typically valid for the likes of using the Nigel Library Hub, using Discovery when you're searching across multiple sources, or more likely in Medline and CINAHL when you're cross-searching them. So just to clarify that, then these are the total results. If you were to scroll down, and we now have pagination included. So for example, this one, if I go to page 4, this will be the final list of items. And then if you scroll down here, you'll see 166 unique results records found. So again, obviously you expect that since you're searching one database, but even you can report on this. It gives you the total result set, which happens to be the same as the unique result set, but it does clarify these are unique results. Okay, again, if you're searching CINAHL Medline simultaneously, then you would have a deduplicated figure at the end of the list there. So we have got the pagination now, so you can jump back to pages between pages as well. Okay, so just conscious of the time here. So you can also, by the way, sort the results by newest as well. If you want to look at the most recent records, you've got the newest or most relevant being based on the relevancy ranking, the subject headings, the words in the title, the words in the abstract, etc., author supply keywords, and so on. So these are now the most recent ones. So obviously we're in August. Okay, this one, July, systematic review, as you can see there. And there's also the option to save a search. So that will save the search from here. I just mentioned this, but that will save it to the save folder essentially, and it defaults to the search string. So again, you would give it a name. So for example, obesity, and use this term. I just put weight reduction for now, and I would save that. Now, this, in a sense, you could say is going to be superseded or is superseded by a search set. So just to highlight again, in the save folder, you'll see the save search. So I'm going to go in here and save search here. So you've got 3 tabs. The first one, the records tab, where we save those records. Then we've got the searches tab. So this is where you'll find that search now, along with others that I saved previously. So it does, append it to the it's a separate search, but also they'll be listed together. You can go into any of these and remove them, actually unsave them basically. So for removing these are you've got the unsaved icon. So you've got the save ribbon, you select it, it'll unsave, as it were. Okay, and if you wanted to, you can add that directly to a project. I've shown you how you can add results and also add a search to a project directly, so that may be the preferred option. So there's kind of different ways of doing it, but I would say there's probably some preferred ways now than when this was first launched. So again, you just click Add Healthy Weight Maintenance and Add Now to that project. So just to highlight that, but we do have search sets now. So search sets, I have some here. Okay, as you can see, quite a few now, and they can be sorted alphabetically, as I mentioned in the slide deck. So you can see adolescents there, BMP, CINAHL, and so on. So these are now sorted or Z to A or oldest. Okay, so you can see where you started from, etc. So these are individual search strings, search sets that I've run and saved and then could rerun. Now, what I'll show you though is you can go in and edit these, by the way. So for example, this one, let's see, go back to this one. If you go into edit, you can edit the name, you can add a description. So you can go back, retrospectively and add content, add information there. So if you generate a list of these search sets and you have a naming convention, maybe you are reviewing that, you want to change it, then you can change the name, you can change the description. But what I want to do here is go back and just show you that the steps for saving it as a search set. Again, so you may have seen it in one of the previous sessions I ran recently. So if I go into search history here, this research set. Okay. I'll resort search actually. So yeah, so okay, we've got a search here. We'll not save this now. A couple of things you can do. I mentioned the saving, we've done that already, I think, or that's a project, but we've got the download option. Now for yourselves, and I know we've had a lot of feedback about knowledge share, about exporting searches. and how you render it, etc. So I can show you PDF Word, but and the PDF can, I mean, the Word document can be edited, of course. But for yourselves, the CSV may be the preferred option, because when you set CSV, you can download that spreadsheet, and then you can open that. Once you save it, you can open it in Excel, which I'll do now, and then just show you how you can edit that based on what I know already from what I've heard. So I drag this across the screen. Now, this is the initial CSV spreadsheet, if you like, of this search history. So it doesn't have everything you want. It has things that you want, but it has things that you don't want. So obviously the search numbers are crucial, the set numbers. Obviously search type is probably not necessary, so you can remove this column. We have the query, so the actual, the syntax, etc., the combined sets, etc. Again, you need that. The expanded query, not so important, so you can remove this column. Then we have the date run. You may record that elsewhere in any case, so you could, in theory, just remove this one. And then you've got others like, now you've got filters here as well, also applicable. So you might want to consider, do you want to include those as well? Okay, so you can see, for example, we're using the English language only, publication date, so it's to the present, as it were, and then publication type, which is important. So the other elements you probably don't really need to know, or you would have a record elsewhere of them. You know, it's on CINAHL and EBSCOhost. CINAHL's only available on EBSCOhost. But the bottom line is, the main thing you could say is the fact that you have these three columns indicating the results that you've retrieved. But obviously with the final set there, we have applied filters. So we've got 2016 to 2026. So it's the exact date as well, by the way. So it's 13th of August 2016 to 13th of August 2026. So it has worked there. So it does record the publication date. Okay, so those elements are also factored into this table. And of course, you can tidy this up, clean this up a bit, make it a bit more interesting, as I'm doing now. And then you can put it into, add the lines, as it were, borders. So again, that option is there. Question there, can we put the saved search sets to the road projects? Unfortunately not. There is an enhancement for that. I submitted that recently based on other comments from another librarian. So at the moment, you cannot have the search sets to a project. So again, we're aware of that. I've submitted an enhancement for that on behalf of one of the other NHS England librarians as well. Okay, and for Michelle, on the Manchester University Hospitals interface, we don't seem to have the suggested returns option on the display. Yeah, so let me just come out of this, by the way. So yeah, nationally, I think it's agreed to have it displayed. So my understanding is that that should be there. It should be visible. It wouldn't need to be switched on for your local instance of CINAHL and EBSCOhost. And maybe you have a higher-end version. I can't remember which version you have, but yeah. So okay, so basically that feature is managed still in EBSCO admin, whereby now we have two tools to administer the interface. EBSCO admin is the traditional tool. A lot of that is still managed there, but there's more and more added to EBSCO Experience Manager, which is the way to go forward in the future. So EBSCO admin is going to be around for a number of years yet, as far as I know. It's not going to change soon. It's a big undertaking to do that. And also, you've been through a lot of changes already. I'm sure you don't need any more of that. Suggested terms that would need to be enabled in the EBSCO admin tool. Okay, so it can be displayed, it can be defaulted to on or off. And I rarely see where it's defaulted to on, because if it's on by default, it means every time a user runs a keyword search, they'll be taken straight to this heading, which for a novice user probably won't be that helpful. They also need more education about that. Yeah, so I'm surprised. You may let the service desk know about that. I mean, I understand there may be some local configurations, but generally speaking, I think nationally it's been agreed that should be seen, that should be shown. So some of these things, that's why we don't run the admin sessions, because Anna Frick and others don't want librarians tinkering with the agreed administration of EBSCOhost. So if it's been agreed at a national level based on feedback, same with the abstracts being displayed by default, that is actually done in EBSCO Experience Manager. But also, if you see it not displayed by default, then obviously there's been a change locally for yourselves. So it's worth considering and worth talking to your colleagues and maybe go through the service desk to clarify that. I think I included that in the PowerPoint, by the way, so we can send more information on that. So again, double check that. It should be showing, as far as I'm concerned, it should be showing across the board, as it were, to each trust, as it were. Now, let me just go back to search sets again, just to show you this. And we've got the search here. So once you complete the search, then you can go to save search set, click that button. It will allow you to give it a name. So I can choose, weight reduction, at least D, okay. And then again, I can add the original framework, the original question, framework, whatever it might be, and then save this. And then I will go to my save folder and go to that third tab where you saw the others listed. So search sets here. And now I'm viewing the most recent. So obviously this is showing now. As I said, you can go into the tools to edit title. I mean, I might want to add CINAHL. Still download the search, by the way. If you want to download it instead, as you could see, when you download, you can download up to 1,000 lines or 1,000 sets. But in terms of the actual search set, it will support up to, it was 500, it's now increased to 1,000, and then the search set itself is 200. So the most I've seen in 15 years at EBSCO is 120 or so. So again, still way below the current limit for saving search sets. Okay, so I think at this time, I will go back to my PowerPoint. So we've had quite an extensive live demonstration. Again, this is the search history. As you can see, I've done this before, a different version of this one. So you've got the various elements of the framework there, the obesity, carbohydrates, weight control, weight gain, etc. And then I followed it up with the elements. I did add prognosis, now not realizing that the clinical queries filter has been disabled for yourselves. I'm not sure why, but it is available generally for CINAHL databases, but it's not showing up there. So I wasn't able to apply the prognosis filter, which it did in the instance that I ran previously on another version of CINAHL. So again, it does record the filters. And of course, once you've found a good article, you can explore the title, abstract, subject terms for more terms that you could factor into your future search. So train support in terms of the current interface, we still have the CINAHL shortcuts help sheet, details the syntax you should be using for CINAHL. You might find syntax from other providers, platforms may still work, but the results won't be so accurate. Okay, so again, try to make sure you stick to the syntax that's appropriate for each platform. And obviously this one for CINAHL. And then there's some useful training materials, including the new one on how to use search sets. Again, if you would explore that further, or if you need to also need to circulate that to your end users as well. And of course, there is the NHS England support page as well, which provides additional resources for advanced searching. So links to content there. And also there's now a new guide, which is also being produced as well. So again, that will give you an overview of the new interface. And we have the healthcare training resources portal with past recordings. Again, I will edit this recording and upload it to our YouTube channel, but you'll get the link to it in any case, but that'll be accessible going forward. And also future training sessions, I'm rolling out more in September as well. So I will update that entry shortly. And also the support pages as well, with additional handouts for database specific information. So if you want more information on CINAHL, those are designated. And EBSCO Connect course is the main support portal with additional tutorials. Again, these are generic, but these will be relevant to the new interface now. The classic ones have been removed. So again, this is going forward, the current interface. Okay, so question here from also Barbara, how long do saved searches remain on the system? Good question. I don't know that there's a time. I know traditionally with the EBSCO area, if you're not signed into it for 18 months, you lose content. But that was with the classic interface. Obviously with EBSCO single sign-on, whenever you authenticate, you are being signed into your folder. So I don't think there's an issue with that. I mean, 18 months is historic based on the legacy and based on the user not using their EBSCO account. So again, I don't think that's an issue. I can ask a question if anyone does know the answer to that, but I'm not aware of any kind of time scale that, after a certain time they're deleted, like with your email, with Outlook, right? You have policies after 2 years, older emails are deleted. I don't think it's the case with EBSCOhost, but I can investigate that further. Okay. So I think that's a good question. Thanks for that. And obviously you can contact me directly at iquicksebsco.com, but again, more information, connect.ebsco.com or your service desk, especially if you have any technical issues. And any of the configuration as well, you may want to check with your local team, colleagues, but obviously you can contact us also. But service issues, technical issues, generally go through the NHS service desk first, and they will escalate to us as needed. And of course, if you have any other training needs, please do let me know. Okay, so appreciate your time. I hope it's been useful as a refresher really of the new interface, the way it stands. All that you've seen today is live, is working, is there right now. This is not preview, this is the live. And this is the NHS site that I'm using through an Open Athens password. Okay,